So there's no one better qualified to talk about the coronavirus than Dr. Joshua Sharfstein. He's a former health commissioner of Baltimore City. He later led the Maryland Department of Health, and we both served in the Obama administration, where he was a top official at the Food and Drug Administration. Dr. Sharfstein knows public health and he knows Baltimore. Dr. Sharfstein, thanks so much for talking with me today about this incredibly urgent issue. So let's get into this. How does the coronavirus differ from the ordinary flu that people get every year? Why is this so much more serious?
Thanks so much, Marian. Thanks so much for having me on. And just to be clear, I'm doing this as on my own behalf and not on behalf of Johns Hopkins University. And as you know, I've offered to all the mayoral candidates to be able to talk about the novel coronavirus, given the scale of the threat to our city. And you asked a very good question, and I really appreciate you having me on to do this. So why is it so dangerous? Why is it worse than the usual flu? And it's dangerous for a couple reasons. The first is it's a brand new virus for humans. And so all of us are susceptible. Usually with the flu, some people get vaccinated, hopefully a lot of people get vaccinated. That reduces the spread and reduces serious illness. Also, people, because they get the flu every year, have a little bit of protection, some people more than others, when the flu comes back. But for this virus, none of us have any protection. So that's one major reason. All of us are susceptible, so the virus can move very quickly through the whole population. The second thing is it's more deadly than flu. The fatality rate is higher, particularly among older adults and people with a chronic illness. And that's why you see scenes like from Italy, where there are not enough ventilators, where patients are in the halls, where it's just a crisis for the healthcare system. That is well beyond what we would see for the flu season, and that's something we're worried about happening here in Baltimore.
So some of the countries that have been most successful in stopping this virus have used really aggressive testing. We seem to still be scrambling to get testing in place. Where does that stand now?
So testing is scaling up rapidly, both at private labs and academic labs like Johns Hopkins and others. There is a big effort to be able to offer up to thousands of tests in the region. And I'm hopeful that within a couple of weeks, a lot more will be available to people in Baltimore. For now, we have to take precautions for people who are, maybe eventually will get a test, but they can. If they're not feeling well, the best thing to do is make sure you stay home. That would be the advice if it turned out you were positive. Stay home, stay away from other people to the extent possible. People are just going to have to do that, assuming they have it for the time being.
So the coronavirus has already transformed a lot of our lives. Are we doing enough in Baltimore City? Are there more steps we should be taking?
Well, I think a lot has happened in the last few days. I mean, people's lives have been disrupted. Schools have been closed. Restaurants and bars have been closed. I think there's a lot that individuals need to do, starting with, washing their hands regularly, really staying home when you're sick, covering your cough, the basics. We really need to do a lot to help people who are in those high-risk categories, so they're not going out to shop and eat a lot. That's also very important.
So we hear the phrase now, flattening the curve. Can you explain what that means in the context of this virus and why that might matter here?
Sure. Flattening the curve means, and I apologize, I don't know if you can hear the dog in the background.
It's okay.
But if you can, I'm happy to step
no,
out.
You're home, which is good.
Okay. The flattening the curve is a concept that we don't want all the people to be sick at once, that we want, if there's a huge number of people who are sick at once, then they can overwhelm the healthcare system just by the sheer amount of illness. And if that happens, that's a big challenge for the whole healthcare system and even people who are sick with other things. What we want to do through social distancing, like staying at home, washing your hands, et cetera, is we want to reduce those peaks of illness so that fewer people get sick at once and the hospital capacity is able to handle that. And then we can gradually control the disease and restart our economy without having a real collapse.
So that might mean a more extended period that we're weathering.
It may mean it. That's a good point. It probably means a more extended period, but I think what we've seen from Asia is that if it's done very aggressively and very well, within a few months you can see real progress, and then you can start to rethink all of the different controls.
So we all talk about some of the great healthcare disparities across the city of Baltimore. Who are some of the most vulnerable people in this current coronavirus crisis? And what should we be doing to help them specifically?
Sure. The most vulnerable people are going to be people over 60, particularly even older than that, people over 70, over 80. They are all in the vulnerable category. And then people with chronic illnesses, diabetes, hypertension, chronic obstructive pulmonary disease, asthma, are certainly at higher risk. And we want them to stay home as much as possible. We want them to work from home if at all possible, or not work, to not be going out and shopping a lot, hopefully to have food and other things brought to them. They should be really hunkered down at the moment. That's the most important thing, to limit social interactions. Now, I really mean that in the physical space. It's very important for people like that not to get too lonely or depressed. And so if you know people like that in your lives, it's very important to reach out to them, be connected through phone, through video chats and other things. And that's what we do with our parents. We're calling them, but we're not going to see them, unfortunately, right now.
Okay. So some of our biggest employers in Baltimore are hospitals. What are we doing to keep our healthcare workers safe and healthy themselves?
So those are two great questions there, safe and helping themselves. So safe requires the appropriate equipment, and there's a lot of attention to that. There's a lot of concern about potential shortages. Safe also requires that people call before they go in for care to go to the right place. Safe requires that we don't have a lot of people showing up at the emergency department when they don't need to be there. Really, the emergency department is for people who are really struggling to breathe. Otherwise, people should call and figure out if there's another place to go, or maybe it's just best to wait at home for the time being and hope that the disease has a mild course. And so it's very important that people who are doing, for example, a test are wearing the appropriate equipment. We really want to limit the challenges other places have had with many healthcare workers getting sick. But then you also said caring for themselves, and that's very important too. The mental health of the healthcare workforce, and by healthcare workforce, I don't just mean doctors and nurses. I mean all the people who are working in the healthcare system, all the way down to people who are cleaning the rooms afterwards, who also have to wear appropriate equipment, who also are under a great deal of stress. Everyone is worried about their own families, their own health. They've heard stories. This is a very stressful time for them. Emotional support for them is important. The assurance that everything possible is being done to protect them is important. And there are also things that the health systems can do in terms of places that they can go to decompress, to share concerns, to seek support mutually from other healthcare workers. Those sorts of things are very important, particularly if this turns into, as we think, a challenge that lasts for weeks or months.
So thinking about this virus, do you think this is the new normal? Are we going to be seeing more pandemics like this? And if so, what should Baltimore City be doing to prepare for these kinds of things? Do we invest enough in emergency preparedness?
Those are great questions. The last one's the easiest to answer, that we do not invest enough in emergency preparedness. And there was a big investment after 9/11, which kind of tapered down over time. It maybe popped up a little bit with some cases of bird flu in the mid-2000s and a little bit with H1N1 in 2009, but it has not really been the infrastructure that we need. And more generally than emergency preparedness, we've underinvested in public health because there are core public health structures that are necessary to run this response to deal with the need for tracing contacts, for example, or providing food or doing other things that are necessary for vulnerable people in Baltimore. So those systems really do need to be strengthened in Baltimore and around the country. Baltimore is not unique in that. Do I think this is the new normal? I think that we have to be prepared for these sorts of things, because if you take a step back and you say, well, this is so bad, but really we kind of dodged a problem like this with H1N1 that it turned out to be mild. We dodged a problem like this with SARS because it was able to be contained relatively quickly. That was 2003. We've dodged MERS, which is another coronavirus, because it is so lethal that it's easier to contain. So if you think, well, this seems like it comes out of the blue, there's actually a few of these that have happened that we've said every time that we're lucky, and now we're not lucky. Now we're really getting hit with something that can cause a huge problem for Baltimore.
So I think I'm just going to ask you, is there a question that I haven't asked you that you would like to be asked about Baltimore and its response to this healthcare crisis?
I think a good question is why people who are likely to have mild illness should care about this. Because, there are a lot of people in the city who are likely to have mild illness. So they go, it's like a cold. So what should I worry about? And the answer to that is each person is potentially a bridge to someone who is quite at risk for more serious illness. And so by reducing all of our social interactions for the time being in this very uncertain period, we can really reduce the number of people who will get very sick. The other thing is young people do have a risk of getting sick. So you're protecting your own health while you're really protecting the health of people who are much more likely to get very ill or even die. And that's why we really need to do as much as we can in the short term. We're going to find out soon whether this is working. I think in the next month or two, we'll have a much better sense. We'll know where things are. This period of uncertainty that we're in, I don't think is going to last very long. We'll really have a better sense of what we're up against and what the trade-offs are, and be able to make better decisions. But right now, we need to put ourselves in the best position to make those decisions. And I think this kind of aggressive action is necessary.
Well, thank you for all of this. I know you're much in demand these days as one of the leading experts on the topic.
Also, my dog wants a walk.
Before we conclude, though, what are the top couple messages you would want people to hear? What are the top things that we should be saying over and over again to get out to the public here?
Yeah, I think that everybody has to do their part. This is something for everyone to change their routines. We have to be washing our hands a lot more and a lot longer each time than we are used to. We really have to be religious about staying home when we're sick. There's a lot that we need to do. The other thing is we can't let the need for physical distance mean that we become emotionally or psychologically distant from people in our lives. We really have to fight uphill to be more connected to other people. And so I think those are the two things, both what we can do for ourselves to reduce the spread of infection, but also sustain ourselves during this really difficult period.
I can't thank you enough. These are just very, very good messages and a great response to all these questions. So thank you for taking the time to do that.
Sure, my pleasure. I really appreciate your doing something like this, and for all the messages that you are able to get out there in Baltimore.
Great. Thank you.